The clinic that we're in today is about infants with dislocated hips. Now, congenital dislocation of the hip or developmental dysplasia is probably the commonest congenital abnormality that occurs in infants. The question is why there is such variation in terms of treatment throughout the world, why there is variation in terms of outcomes, and can we provide a treatment protocol which is guaranteed to work. Now, we have been applying the Pavlik harness here, and it's a splint, and we have a treatment protocol for the splintage, its duration, the way in which it's managed. And all of that occurs in this research clinic according to protocol with data collection at appropriate times. We've recruited 140 odd patients. We have to have a proper facility in order to do that. It's much more luxurious, it's much better atmosphere, with more attention to detail and more care in the research clinic, amazingly. In terms of what causes hip dysplasia, we know that family history and breech presentation are important. One of the other major factors, however, is postnatal environmental factors. And one of the most potent factors there is swaddling. And so we're collecting data on swaddling, and in the last few years there's been almost an epidemic and a resurgence of tight swaddling, mainly because it is alleged that it makes the child sleep better and helps colic. The International Hip Dysplasia Institute has a very comprehensive website with pictures and diagrams of what we consider to be the optimum position for the hips in infants under the age of 6 months. Not binding the legs in extension straight down, but allowing the legs to assume the human position for the first 6 months, which is essentially flexed and abducted outside. And so, yes, you can swaddle the body, but you don't swaddle the hips. So I think there is an awareness, and there is a central awareness that it is a treatable condition which is common and has important consequences in terms of requirement for total hip replacement for secondary osteoarthritis in young adult life. In Norway, recent figures have shown that almost 70% of women who required a hip replacement at 40 had it because of hip dysplasia. So my message to my clinician colleagues is that clinical research in the right environment and prosecuted properly with data collection and all supported by the NIHR, CLRN and all those agencies who actually do encourage research, this is absolutely pivotal to clinical progress.